So we are now down to our last subtopics about autism spectrum disorder, which is the intervention and the treatment. So let us start first with the intervention. Early interventions occur at or before preschool age, usually 2 to 3 years of age. So the sooner the child gets help, the greater the chance of learning and progress. It is the best chance on developing them to their full potentials. So, why is it so that we will have a great chance or possibility on developing autistic children if ever madiscover na to ang ilang symptoms as early as possible? And it is because in that age or period, a child's brain is still forming, meaning it is more plastic, but not like the literal meaning of plastic, but more on its characteristic, like it's more changeable than at older age. So, because of this plasticity, treatments have a better chance of being effective in the longer terms. So, diri na to mosulod ang atong panultion nga, di ba, wala sila nga, samtang bata pa, kay dapat i-change na nimo siya, kay kung magkadako, magkalisod na siya usbon, ari ni siya mo apply. So, let's move on to the different types of treatment. So, there are many treatment available as of the moment. These includes behavioral, developmental, educational, social relational, pharmacological, psychological, and complementary and alternative approaches. So, let us now tackle first the first treatment of ASD, which is the behavioral approach. So, behavioral approach focuses on changing behaviors by understanding what happens before and after the behavior. It has the most evidence for treating symptoms of ASD. A notable behavioral treatment for people with ASD is called Applied Behavior Analysis, or ABA. So, ABA encourages desired behaviors and discourages undesired behaviors to improve a variety of skills. So one example of this is whenever an autistic child is throwing tantrums, you will just ignore them and let them realize that what they are doing is wrong. And whenever they do good, you will compliment them or reward them for being behaved. Next, we have the developmental approach. So, developmental approach focuses on improving specific developmental skills such as language skills or physical skills, or a broader range of interconnected developmental abilities. So, the most common developmental therapy for people with ASD is speech and language therapy and occupational therapy. So, let's focus first on speech and language therapy. So this one helps to improve the person's understanding and use of speech and language. So some people with ASD communicate verbally, others may communicate through the use of signs, gestures, pictures, or an electronic communication device. So example of speech and language therapy applies when ang usa ka mama or di kaya bisag kinsa or iyang doctor tudloan niya ang usa ka autistic child simply how to speak. But as we all know nga there are other autistic child nga dili sila kusog when it comes to verbal. Ang ilaha lang kay sign language or di kaya mo identify sila pictures tas sundon nila. And we also have these electronic communication devices. Recently lang viral to siya sa usa ka Facebook nga there are engineers who made a device nga mag-sign language sila, and that device will translate and speak kung unsa to nga sign language ang ilang gibuhat. Next is we have the occupational therapy. This therapy teaches skills that help the person live as independently as possible. Skills may include dressing, eating, bathing, and relating to people. So, example of occupational therapy is kanang atong daily routines like how to eat, how to take a bath, how to brush your teeth, how to put on shoes, how to put on clothes, to make them independent na. Like, they can do those things without the help of others na. That's the purpose of occupational therapy. Next, we have the educational approach. Educational treatments are given in a classroom settings. So, one type of educational approach is the treatment and education of autistic and related communication handicapped children, or TEACCH approach. TACCH is based on the idea that people with autism thrive on consistency and visual learning. So it provides teachers with ways to adjust the classroom structure and improve academic and other outcomes. So as we all know that autistic children are very intelligent. They may not able to do simple things that normal people can, but they find it very easy to do. Those are hard things for us who are normal. Since educational treatments are given in a classroom settings, which means that teachers are the ones who will facilitate the TACCH approach. So, for them to do so, they will adjust their classroom structures or improve their academic and other outcomes. For example, like, instead of using sentences or words to teach their students, they will just use pictures, because autistic children are very consistent when it comes to visual learning. So it will be much easier for autistic children to learn in that way. Next, we have the social relational approach. Social relational treatments focuses on improving social skills and building emotional bonds. Some social relational approaches involve parents and peer mentors. The developmental individual differences relationship-based model, or also called as floor time, encourages parents and therapists to follow the interest of the individual to expand opportunities for communication. So, when does floor time applies? This applies when your child is interested on doing something. You will join them or play with them for you to create emotional bond. Pharmacological approach. So, unfortunately, there are no medications that treat the core symptoms of ASD as of now, but there are some medications that treat the co-occurring symptoms that can help people with ASD function better. For example, those medications might help manage high energy levels, inability to focus, or self-harming behaviors such as head banging or hand biting. It can also help manage co-occurring psychological conditions such as anxiety or depression, in addition to medical conditions such as seizures, sleep problems, or stomach or other gastrointestinal problems. So, yes, you heard it right. Wala pa joy tambal sa ASD. Ang naa lang jud nato ron kay kanang mga medications nga kanang makatabang to help them function better. Next, we have the psychological approach. So, psychological approach can help people with ASD cope with anxiety, depression, and other mental health issues. So, we have this cognitive behavior therapy, or CBT, one psychological approach that focuses on learning the connections between thoughts, feelings, and behaviors. So, during CBT, a therapist and the individual work together to identify goals and then change how the person thinks about the situation to change how they react to the situation. So, in CBT, this is where kanang mga heart-to-heart talk sa ka-patient and their therapist. So, lastly, we have the complementary and alternative approach. So, some individuals and parents use treatments that did not fit in any other categories, like atong mga behavioral, educational. So these treatments are known as complementary and alternative treatments. These are often used to supplement more traditional approaches. They might include special diets, herbal supplements, chiropractic care, animal therapy, arts therapy, mindfulness, or relaxation therapies. So individuals and families should always talk to their doctor before starting a complementary and alternative treatments. So why do they need to consult their doctor first man before doing complementary and alternative treatments? It because that there are other complementary treatments nga dili siya angay i-apply sa usa ka autistic child kay it might trigger them